Some medical news now, a high-tech brace offering some knee pain sufferers an alternative to surgery. It's known as Bionicare, and it's technology that has both supporters and skeptics.
Okay, so here, any pain? Yeah, that hurts a bit. How about if we push there?
Kim Georgia is no stranger to pain. Arthritis in her left knee can sometimes make it difficult for her to move normally.
The pain level, I guess, would be like a 7.
But she says she's found relief with a high-tech knee brace sold under the name Bionicare. The brace is fitted with electrodes which deliver a low-intensity charge known as pulsed electronic stimulation into her knee and thigh area.
It definitely does bring the pain level down to a place that is much more functional.
I tell people the less than a Christmas tree light worth of electricity.
Kimberly's doctor, Moshe Lewis, says the brace itself helps stabilize the knee during movement, providing some of the relief, but he says the electronic pulses also contribute to the effect.
The brace itself is allowing you to actually correct any misalignment of the knee. And then the TENS, or the electrical stimulation piece of this, is allowing the patient to not experience so much pain.
According to the company, the device delivers a negative charge similar to electric pulses present naturally in the cartilage of the knee joint. They theorize that electricity is part of a system that helps keep the joints healthy, a system that's interrupted by osteoarthritis.
It's really trying to help limit the pain, which allows the person to move, and one can't go so far as to say that it's actually rebuilding the cartilage, but there is something to electrical stimulation being very important for growth of things.
The device is FDA approved, but other orthopedic specialists we spoke with are more cautious about the Bionicare device, which costs about $1,500. And at least one new study is raising questions about its value. The Australian study, published in the journal Arthritis and Rheumatism, gave patients with mild to moderate symptoms electronic pulses similar to those delivered by the Bionicare. It found the level of relief was no different for patients who received the pulses than those who were given a placebo version.
No one even knows if putting a charge across the skin of a knee changes the charge inside the knee joint. Never mind actually stimulate cartilage.
Dr. Susan Lewis is an orthopedic surgeon and sports medicine specialist at St. Francis Hospital in San Francisco. She says while there is no risk from the stimulation, patients would likely also benefit from less expensive systems.
You could even just try a simple brace, a much more simple brace that doesn't have all the fancy electrical stimulation going through it. Is probably as effective. In fact, none of the studies have compared that brace to a more simple brace.
Bionicare's creators have challenged the Australian study, in part because it didn't involve the actual device. They point to the company's own research that found the brace helped about 60% of patients delay knee replacement by up to 4 years. Kimberly, Georgia, believes the Bionicare has allowed her to move with less pain.
Now I'm able to do those kinds of things that I wasn't able to do prior to utilizing this brace. So it makes my life better.
Now, not all insurance plans cover the Bionicare brace. You'll find a link to the company at abc7news.com. Just look under See It on TV.